So we agree that there are reasons to participate in humanitarian response and reasons to follow principles and standards. So this is what we have been talking about, and I have some pictures of it later, but there is a tool that you can hold in your hands to help you follow all these principles and standards and put them into practice. And it actually is in paper and electronic format, so you can have it on your cell phone, which is called the Sphere Handbook, which is used internationally and widely used and recognized and known, but we don't know much about it in the United States. The Sphere movement started in 1997, actually from humanitarian professionals and organizations saying, we need better quality and accountability in what we're doing. So some of it's both secular and Christian and faith-based, so World Vision, Oxfam. There's 40 to 60 organizations right now involved in the Sphere project, so these are just an example of them. And they came together and wrote the Sphere Handbook. It was collaboratively written. It gives us a common language for all of us to use so that we can all be on the same page. And in 2018, they printed the 4th version. That edition had input from over 1,200 participants in over 65 countries and over 450 organizations. So again, it's quite widely known. But this is where it's in use. And this was a slide from 2016. These were the areas of crisis in the world in that time, and the green dots are where people are using the Sphere Handbook. Where are we not using the Sphere Handbook or knowing about it? In the United States. Where are we using it? Pretty much the rest of the world, maybe a little bit of Europe and Asia, not. And this is who's using it. It's being used in response, after response and relief efforts, but also in recovery and preparedness, so kind of all throughout the cycle, by NGOs, governments, academics, lots of different organizations. Now, the Sphere Handbook, as we'll see, has the principles and how to apply the principles, and then 4 categories of life-saving things: water, sanitation, and hygiene, food, shelter, and health. So all of these that we listed kind of come at the end after we know the principles. But this last category is the health category. What's the lowest use of category? The health category across the world. This was also in 2016, people using Sphere Handbook across the world. So we have a lot of preparation to do. This is the Sphere Vision, a world in which all people affected by disaster or conflict are able to reestablish their lives and recover their livelihoods in ways that respect and promote their dignity. So again, how do we provide relief and aid and assistance and respect and promote dignity at the same time? Sphere core beliefs are people affected have a right to life with dignity, and all possible steps should be taken to alleviate human suffering. So sometimes they seem mutually exclusive, or they don't seem to go together. But what happens when we provide, if we don't alleviate suffering? People die, right? Morbidity and mortality. What happens if we don't protect dignity? We create dependency and paternalism, and it's not sustainable. So the Sphere Handbook has a humanitarian charter with these principles: right to receive humanitarian assistance, right to life with dignity, and right to protection and security. They took the legal and ethical basis to make this humanitarian charter with those 3 rights or principles, and then several different organizations also came together and made a core humanitarian standard, which we'll look at next. The core humanitarian standard is the process standard. It's saying how the legal and ethical and the humanitarian charter, that's why we do. Why do we respond? Then the core humanitarian standard says, okay, how do we take those principles and put them into practice? How do we respond in a way that is amenable with the principles? And then the technical standards are kind of what we do, like the WASH, the medical, the healthcare, the arms and legs behind it. That's a quick structure. So the core humanitarian standard, again, has, what do we notice? Who's in the center? Communities and people affected by the crisis. So our response efforts, we are first accountable to the communities and people affected by the crisis, and they are the first people that need to be consulted. And the commitments are to them as well as to each other and to our donors. The commitments talk about things like relevant and timely, coordinated assistance, focusing on things, avoiding negative effects, the principles that we've talked about throughout the morning. And each of these 9, so it's one standard with 9 commitments, and each of the 9 commitments has actions that you can do to meet that commitment, indicators to tell you that your actions are working and you're meeting the commitment, and guidance as to how to contextualize it. So who has ever written a program or a proposal for any type of humanitarian work or any other work, or a lesson plan or anything? Okay, a few of us. So I didn't know about Sphere when I was the program director of Samaritan's Purse medical projects in Haiti. And when I learned about Sphere 2 years after I left that job, I was like, well, this would have made my job so much easier. This basically writes my whole proposal for me, right? So that's one of my favorite parts. And the other thing is, can you see how this process standard that tells us how to implement things, it meets Maria's concerns that we talked about at the beginning, right? And it leads into meeting our concerns of doing everything, promoting dignity, but saving life at the same time.